G'day, sirs and madams and sirs, I'm Dr. Tor, Dr. Know-It-All, and indeed I do, and with me is my trusty pipe Woody. All I need now is a little pot. Smashing good form! Today, I'm going to take you on a journey to discover the world of seizures. Now, these seizures include partial seizures and generalized seizures. Now, partial seizures include simple partial seizures and complex partial seizures. Generalized seizures, on the other hand, include absent seizures, myoclonic seizures, atonic seizures, and tonic, we all love it, clonic seizures. Our first discovery of the day is simple partial seizures. Now, manifestations of simple partial seizures include alterations in motor function, sensory signs, or autonomic or psychic symptoms. Now, typically, the motor portion of the cortex is affected, causing recurrent muscle contractions of the face or contralateral part of the body, such as your finger or your hand. Now, motor symptoms you might see of simple partial seizures are jerking of the fingers and hands, your head drawn to your shoulder, your eyes move side to side, and your face would twitch. You also have silly unusual movements of the tongue. Sensory signs include a breeze on the skin, unusual hissing, a buzzing or ringing noise in your ear, and unusual voices. Mo, did you hear that? Unpleasant taste, strange smells. Mo, was that you?
Sorry about that.
Disgusting. And seeing things disorderly. Autonomic signs include tachycardia, respiratory inhibition, pupillary dilation, incontinence, oopsie daisies, and sweating. Psychic symptoms include unprovoked emotion of fear, happiness, sadness, crying, laughing, detachment, daydreaming.
Doctor, no.
Yes, time and memory distorting, flashbacks, son of a... deja vu. Now, this is an example of a simple partial seizure. Now, let's explore what and what not to do in a real-life complex partial seizure situation.
Yeah, man. That was crazy. I'm so tired.
Yeah, so am I.
Hey, Danny boy, what's going on?
Hey, what's up, dude?
I just want to introduce you to my girl, Stephanie.
Hey.
Hey, what's up?
Hey, I gotta use the bathroom really quick. I'll be hitting on my girl now. I'm watching you. I'm just kidding.
So what are you reading? Anything good? What the heck is wrong with you? Oh my god, you're disgusting!
Ooh, right in the kisser! Let's try that again, shall we?
Is everything okay? Mo, you need to get out here.
Hey, what's going on?
I don't know.
Oh, I think he's having a complex partial seizure. Hey, buddy, you alright? Hey, Dan, can you hear me? Relax, man. You alright, buddy? Hey, man, just listen to my voice, man. You alright? Where you going, buddy? Can you hear me? You alright? Hey, listen, Dan. Try to wake up.
That's the ticket!
Dr. Noe. Dr. Noe. Dr. Noe. Dr. Noe.
Jesus, what? I'm trying to clean my woody.
It's time to go film.
Oh, how randy, let's go! Now, next subject of discussion is generalized seizures. Now, these seizures include absent, tonic, myotonic, and tonic-clonic. Now, generalized seizures involve both hemispheres of the brain, as well as deeper brain structures. Now, these structures include the thalamus, the basal ganglia, and the upper brain stem. Now, don't forget, consciousness is always impaired. Now let's talk about absent seizures. Now these used to be called petite mal seizures, and typically occurring in children and only lasting a few seconds. I know we've all been there, haven't we, laddies? Now symptoms of absent seizures include staring and transient loss of responsiveness, along with slight eye fluttering and muscle jerking movements. Now, absent seizures may be very indirect and can be mistaken as daydreaming. Now, let's give an example, shall we? Now let's discuss myoclonic seizures. Now symptoms of myoclonic seizures include jerky body movements, typically in the upper arms and shoulders and in the neck. Now patients with myoclonic seizures seem to be very unsteady and clumsy, like a monkey wearing stilettos on its wedding day. Now let's have an example, shall we? Next, we have atonic seizures, otherwise known as drop attacks. Why? Because the patient will fall or drop to the ground for no apparent reason. It only lasts a few seconds. What happens is the patient becomes weak, their head will droop, and the body simply can't hold itself up any longer. Let's see an example, shall we? Oh, what a pity. I hope he's okay. Last but not least, we have tonic-clonic seizures. Now these are the most common seizures, which are referred to as grand mal seizures. Now these are the ones most associated with epilepsy, which a loss of consciousness and muscle contractions indicate the tonic aspect of the seizure, along with a hoarse cry and a loss of bladder and bowel function. Oopsie daisies! Breathing can also stop for a moment. Now the clonic phase is when there is an alternating between contraction and relaxation of the muscles. Now this is a more serious, more delicate matter, so let's take a serious look into a good example.
Anyways, it makes all kinds of lines. Why don't you guys go out, because the nurses are going to be coming in. Hi. Not a problem. generally vomits after.
He does? Okay.
Yeah.
Okay.
And he quite often loses bladder control.
Okay.
So.
Now, let's go over treatments for seizures. The most prescribed and main drug of choice for seizures is none other than Dilantin. Let's go over some facts, shall we?
Dilantin is an anticonvulsant, antidysrhythmic medication. It inhibits the spread of seizure activity in the motor cortex by altering ion transport. It also increases AV conduction. It can be used for generalized tonic-clonic seizures, status epilepticus, non-epileptic seizures associated with Reyes syndrome or after head trauma, Bell's palsy, and complex partial seizures. Its side effects include drowsiness, dizziness, insomnia, depression, suicidal tendencies, aggression, headache, confusion, slurred speech, peripheral neuropathy, hypertension, nystagmus, diplopia, blurred vision, nausea, vomiting, constipation, anorexia, weight loss, hepatitis, jaundice, gingival hyperplasia, nephritis, urine discoloration, angranulocytosis, leukopenia, rash, lupus erythematosus, Stevens-Johnson syndrome, and hypocalcemia.
I'd like to thank you for watching this presentation. I hope you've had fun. I know I have. Once again, my name's Dr. Tall, Dr. Know-It-All, and indeed I do. And now I'm going to leave you with a clip of all the seizures combined. Have a great day.
Con los terroristas.
Harlem Shake.
Con los terroristas. Con los terroristas.
And do the Harlem Shake.